Here's how to interpret an arterial blood gas in 3 easy steps. First, we'll go over some crucial fundamentals. The pH level is inversely related to the concentration of hydrogen ions, aka acidity. So a lower pH means the concentration of hydrogen ions is higher. Normal arterial pH is between 7.35 and 7.45. A pH below 7.35 is acidosis. A pH above 7.45 is alkalosis. A couple of things to know about hydrogen ions. In our blood, they can react to form CO2. That reaction looks like this. CO2 plus H2O becomes H2CO3, otherwise known as carbonic acid, which can then become a hydrogen ion and bicarbonate, HCO3-. Normally, there's a sort of sink effect of CO2, where we breathe out CO2 into the air. This results in the reaction shifting towards the left, and hence a decrease in blood hydrogen ion concentration, aka an increase in pH, alkalosis. Of course, normally this sink effect doesn't cause respiratory alkalosis, since our metabolism provides a steady supply of protons and CO2. However, the sink mechanism sometimes gets exaggerated, which occurs when someone hyperventilates. Hyperventilation is a cause of respiratory alkalosis. On the other hand, someone may have a reduced pulmonary function, for instance due to chronic obstructive pulmonary disease. What will happen then? In this case, the expiration of CO2 will be decreased, and this reaction will shift towards the right, leading to an increase in the arterial concentration of hydrogen atoms, aka a lower pH, acidosis, more specifically, respiratory acidosis. Now, let's zoom in on the metabolic part of the equation. This bicarbonate, HCO3-, is a pretty important fella. It's a buffer that's capable of neutralizing protons. Crucial to the production and reabsorption of bicarbonate from the blood are the kidneys. If the kidneys malfunction, there will be a shortage of bicarbonate, and the weight of the reaction will shift to the right, causing an increase in hydrogen ion concentration, aka a lower pH, aka acidosis. This may also occur with other causes, such as diarrhea, where bicarbonate is wasted. By contrast, a metabolic alkalosis may occur due to vomiting, ingestion of bicarbonate antacids, or diuretic use. Now, here's the promised 3-step plan to arterial blood gas interpretation. Step 1. What's the pH? Low pH, acidosis. High pH, alkalosis. Step 2. Does the PCO2 explain the pH? An abnormally high PCO2 explains an acidosis. An abnormally low PCO2 explains an alkalosis. Step 3. Does the bicarbonate explain the pH? An abnormally high bicarbonate explains an alkalosis. An abnormally low bicarbonate explains an acidosis. Whichever explains the pH is the determining factor, e.g., respiratory alkalosis or metabolic acidosis. That which opposes the pH is the compensatory mechanism, e.g., respiratory alkalosis with metabolic compensation. Here's an example. pH high, PCO2 low, and bicarbonate normal. Now there's an alkalosis. The PCO2 can explain the alkalosis, so it's respiratory, and there is no metabolic compensation. Here's another example. pH is low, PCO2 is low, and bicarbonate is low. There's an acidosis. The PCO2 doesn't explain the acidosis, so this low PCO2 must be compensatory. The bicarbonate does explain the acidosis, so this is a metabolic acidosis with respiratory compensation. Here's a final example. The pH is low, the PCO2 is high, and the bicarbonate is low. There's an acidosis. The PCO2 explains the acidosis, so the acidosis is respiratory. The bicarbonate explains the acidosis, so this acidosis is also metabolic. Hence, this is a combined respiratory and metabolic acidosis. That's it. Thanks for watching. Hope you enjoyed.